I'm Ryan Gorman, and I want to bring in a couple of very special guests right now from the Central Florida Behavioral Health Network. And let me start with our good friend, Doris Nardelli. Doris, how are you today?
I'm great, Ryan. Thank you for having us on and being able to talk to your listeners. Have a very special guest here with me today. It's our president and CEO, Alan Davidson, and he's going to talk about a very special awareness month that May is.
And of course, everyone can find out more about all the great work they do at Central Florida Behavioral Health Network at CFBHN.org. Alan, it's really great to have you on today. And I understand that Central Florida Behavioral Health Network is a managing entity. What exactly does that mean? What do you do?
Yeah, good to be on. So CFBHN is a not-for-profit 501c3 corporation and a CARF International Accredited Services Management Network organization contracted with the Department of Children and Family. CFBHN fulfills this mission by contracting with community service organizations to provide a full array of publicly funded mental health and substance abuse services in the 14 counties that comprise the Suncoast region. Services include acute care, residential treatment, housing, medical, outpatient, recovery support, and prevention.
Of course, May is Mental Health Awareness Month. Can you talk a little bit about that and Central Florida Behavioral Health Network's role in that monthly designation?
Yes, it is Mental Health Awareness Month in May, and we should be checking in to find out how is everybody doing. In case you missed it, Sesame Street's lovable Elmo posed that very question on social media earlier this year, and the responses came flooding in. From relationship problems to financial troubles and feelings of exhaustion, angst, loneliness, and disconnection, people shared their struggles. At last count, Elmo's post had garnered more than 217 million views, 15,000 reposts, 165,000 likes, and 45,000 responses on one social media platform alone. What this helps reveal is that many of us are not okay, and it's important to acknowledge and address that and make sure people know help is available. That's why CFBHN exists, and we have services and supports to help you be okay.
Do mental health conditions affect just certain groups of people at certain times in their life? Can you talk a little bit about that?
Yeah, absolutely not. Mental health conditions can affect anyone, regardless of gender, age, race, ethnicity, or income level. Recent data underscores that our nation is facing an unprecedented mental health crisis among people of all ages and backgrounds, including young children and older adults. To put this into perspective, if you were standing in a room full of people, at least one out of every 5 of those people likely experienced anxiety, depression, or other mental health conditions in the last year. The good news is mental health conditions are treatable, as illustrated by many athletes, entertainers, and prominent public figures who have spoken openly about their experiences. People living with mental illness can and do lead happy and productive lives. And this includes serious mental illnesses such as bipolar disorder, major depressive disorder, and schizophrenia, which can interfere with someone's life and ability to function. Similar to medical conditions like diabetes, with early and consistent treatment, people with serious mental illnesses can manage their conditions, overcome challenges, and enjoy meaningful, productive lives. At CFBHN, we are committed to increasing access to mental health services and support. We understand that many Americans may feel reluctant to reach out for help or to seek care. We want you to know that we see you, we hear you, and we support you. We believe that with the right care, anyone affected by or at risk for a mental health condition can achieve well-being and thrive. And if you take care of yourself, you might also be a support for others, a lifeline for someone else.
So during this Mental Health Awareness Month, and really every month all year round, what can we do to help ensure we take care of ourselves and others?
Yeah, May 16th is Mental Health Awareness Day, and it provides an opportunity to take the next step from awareness to action for yourself, a loved one, or your community. This could be as simple as adopting a positive mental health habit, like eating a balanced diet, getting a good night's rest, or exercising, or offering support to a friend or family member who is struggling. Here are some additional strategies to consider. Practice gratitude. Think about something you're thankful for, like supportive family and friends, a safe home, or even a beautiful day. Volunteer. Participating in community organizations and finding opportunities to help others can provide a positive boost and a sense of purpose. Engage in random acts of kindness. Buy a cup of coffee for the person standing in line behind you. Hold the door open for a stranger or make food for a neighbor or colleague. Practice mindfulness. Take a few classes and minutes to take a yoga class or do some breathing exercises to promote relaxation and reduce stress. And finally, seek help. Whether it is for yourself or someone else, seek help through CFBHN's resources. Recovery is possible.
Alan Davidson, President and CEO of Central Florida Behavioral Health Network. You can learn more again at CFBHN.org, especially important during this month of May, Mental Health Awareness Month. Also, of course, we have our good friend Doris Nardelli with us. Alan, Doris, thank you so much for taking a few minutes to come on with me. Really appreciate it.
Great. Thank you so much.
Thank you.